what can you tell us about the announcement that happened around noon regarding the ICU bed capacity in the greater Sacramento region and the state's public health order?
So we've now gone below 15% in terms of our vacancies for ICU beds. So that triggers a stay-at-home order for 3 weeks at least from the state. And that means that things like eating outdoors and restaurants, movie theaters, gyms and fitness studios indoors, and churches indoors will all be prohibited.
And how does this stay-at-home order differ from what we were in March?
It doesn't differ terribly much. I think the retail shops are allowed to stay open a little bit more than they were before, but it's relatively similar to the one in March.
Can parks be open?
So the interesting things is parks and playgrounds are open with appropriate social modification like cleaning and staying 6 feet apart. And they're trying to build on the data which we've learned over the last several months that being outdoors is much, much safer than being indoors. And so outdoor activities are both helpful for people's physical activity, but also for their mental stress.
And what about schools? Last March, when we had the stay-at-home order, schools shut down.
Right. So schools that have opened in Sacramento County when we were on the red tier can remain open. Those that have been closed remain closed.
And do you believe with the holidays coming, Christmas and then New Year's Eve, that we will be out of the stay-at-home order in the 3 weeks?
No, I don't think we'll be out of this in 3 weeks. They'll be reevaluating at the end of 3 weeks. But I think that the number of cases we have now, which are surging tremendously, are all related to Thanksgiving. And so that we're baked in for the number of cases of Thanksgiving for these couple of weeks. 2 weeks down the road from now, we'll be having the hospitalizations due to Thanksgiving transmission. It's not until the first of the year that we'll be having transmission and the cases due to Christmas and then New Year's. And so if we see any kind of change at all, it won't be until that period of time. So in order for that to happen, we have to bend the curve, as we've said many, many, many times. And that means wearing masks, socially distancing, and not gathering with people outside your household.
So we could be in the stay-at-home order until the beginning of next year?
Certainly until the beginning of next year. That's sort of the bad news. The good news is that we are very close, literally within a week, of starting immunizations in small numbers, but getting larger and larger as we go along. So if we can just help in the next 8 weeks to bring down the number of cases, to reduce the unnecessary hospitalizations and deaths and ICU visits, we'll be into the immunization season. For ICU beds, we are not going to be able to influence the number of people that are going to end up in the ICU due to Thanksgiving infections. What we can do is reduce the number of people going to the ICU for Christmas and New Year's types of infections. So the more we can bring those infections down, the better we do in terms of intensive care unit.
And we had a viewer who reached out and said, when the beds fill or we're at 14%, what happens to those patients who need an ICU bed but can't get one?
Very good question. We've been asked that a fair amount, and that's when you have an ethical conundrum. You have to make a decision on who gets the ICU bed and who doesn't. And that's what we're trying to avoid happening by having these stay-at-home orders, is trying to decrease the number of ICU beds that are being used so they're available for people who need it. Because remember, ICU beds are for not just COVID patients, they're for heart attack patients, for stroke patients, for vehicular accident patients in certain types. So we need to have these beds available for everybody in the community who's still getting hurt and still getting sick. Just because there's COVID doesn't prevent that from happening.
Will COVID patients get priority to the ICU beds than someone who got in a car accident or had a heart attack?
Not necessarily. It really depends. It depends on a whole bunch of ethical constructs, including age, likelihood of survival, and things like that. So, like, for example, I don't want to get into too much, but a 25-year-old who has severe pneumonia and is needing, that's not a good question. Hang on. A 30-year-old who comes in with a motorcycle accident and may need an ICU bed versus a 90-year-old COVID patient who is unlikely to survive, you may actually have to favor one over the other. So we want, but the bottom line is we want to avoid making decisions that are unnecessarily deadly, unnecessarily. We want to avoid making decisions that are unnecessarily difficult. And so that's why we're trying to prevent the number of trying to reduce as much as possible the number of new ICU visits as possible.
And who's actually in our ICU beds when it comes to the greater Sacramento region? Are we accepting people from outside of the county, or are these all just people in the greater Sacramento County?
The vast majority are from Sacramento County. The majority, by the way, are not COVID patients, obviously. Only 15 to 30% of the patients are COVID patients. And now they're growing a little bit more. But most patients in the ICUs in the Sacramento County region are from Sacramento County and are there for reasons not related to COVID. What we're trying to do is keep the COVID section down, the COVID component down, so that we can have enough ICU beds for everybody else.
Are we accepting people from outside of the county?
Yes, because there are some very small counties in surrounding Sacramento County that actually don't have a hospital and only have one hospital. So yes, that's the case. But Sacramento County is 1.5 million people. And so we have a lot of beds in Sacramento County. We have 535 beds and ICU beds available at any given time regularly. And we have 400 surge capacity beds. And then we now have the Sleep Train Arena opening up today for its first 20 beds. And then for the next couple hundred beds in the near future, which will allow them to decompress the hospitals by taking care of COVID and non-COVID patients.
And that was my next question. With Sleep Train Arena, they're not opening with ICU beds, but they can help with alleviating.
Yes, they can alleviate the stress of both COVID and non-COVID patients in the hospitals by decompressing the hospitals and placing them at Sleep Train Arena.
Because just because you have COVID and you're in the hospital doesn't mean you're necessarily in an ICU bed or need one.
That's correct.
And if you can't answer this, that's okay, but I want to bring it to your attention. For example, Yuba in Sutter County is looking at 2%. Is it possible that they will start sending patients to us, which will hurt our ICU capacity as well?
Yes, it would be possible that they would send patients here. But remember, Yuba and what was the other county?
Sutter.
Okay, sorry. Yes, it's potential because there's mutual aid that allows for that to happen. But remember, Yuba and Sutter counties are very small and they have very few patients.
So it won't hurt us that much to have
Correct.
Their patients come our way. And then when it comes to the stay-at-home order, is there a date that you think that we will get out of this?
Yes, it's clearly, I think very definitely will not be in 3 weeks. It's going to be longer. And the reason for that is that our number of cases that we have now that we're surging with are baked in, and they're from Thanksgiving and they're baked in. They're already here from the 2 to 14 days. And the hospitalizations from Thanksgiving will be 2 more weeks from now. So those are already here and they'll be in the ICU. There's nothing we can do about them. So all we can do is affect the next 3 to 4 weeks, which is through Christmas and New Year's, and try to reduce the gatherings, use face masks, socially distance, so we have fewer cases in that 3 to 4 week period than we have in this 3 to 4 week period, because right now we're basically guaranteed to have stay for 3 weeks just by our Thanksgiving cases alone.
And I want to ask you this question again. You kind of already answered it. When it comes to Sleep Train Arena and how it's helping alleviate the hospitals, what kind of patients are going there? And if you can't check yourself into Sleep Train, how do they decide who gets to go there?
Good question. So it's the point of Sleep Train Arena is to decompress, to alleviate the stresses at the hospitals. The hospitals will send the patients directly there, or divert them from coming into them in the first place. And they will be seen there, and they're both COVID patients and non-COVID patients that will be seen at Sleep Train Arena.
And what about staffing in the hospitals? Even if we get some alleviation with these ICU beds, do we have the staff to help?
So staff is getting to be a problem. It's not so much the beds, you're right, especially surge capacity beds, which go beyond the ICU beds. We have plenty of surge capacity beds. The problem is getting staff to staff them. So we're working with the Medical Reserve Corps to get volunteers to come in to help to alleviate the stress for a period of time. but there's a limited number of them. So that's, again, another reason why the stay-at-home order is being enacted, is to try and keep people out of the hospital and the emergency rooms, to keep them free of those patients, and also to avoid the need for more staff.
And when it comes to deciding who's going to get the ICU bed, and if, you know, I hate to say it like this, they flip the coin and you don't get it as a patient, is it possible that you will die?
Yeah. So the issue is with these ethical conundrums is, you know, when there is plenty of room in the hospital and plenty of room in the ICU beds, the patient who's in the ICU bed both gets really good care and gets care that you would get in the ICU. When you don't have enough beds, by definition, you're going to have to make a decision, and that can be tragic.